Hello, I am Dr. Mukesh. Today I am going to talk about obsessive compulsive disorder or OCD. OCD is the fourth most common psychiatric illness. It affects equally both male and female. Average age of onset is around 19 to 22 years. Around two-thirds of cases present before 25 years of age, and 15% of patients have onset after 35 years of age. At times, it can occur after some stressful event, or a trigger can be seen, such as pregnancy, some losses, etc. OCD has two components, obsession and compulsion. So, patient do present with either of them or comes to the clinical attention. Obsession can be defined as repetitive, intrusive thoughts which are unreasonable, excessive, which are involuntary and at times cause distress in the patient. For example, thoughts of contamination, thought of blasphemy, need for symmetry. So patient can present in the clinic with the concerns from the relative that he spends too much time washing hands. So when you go into the history, you will find the patient has concerns about the contamination, that his hands had got contaminated, and if he doesn't wash his hands properly, it can lead to some bad results. And this is at times time consuming. Patient can spend 2 to 3 hours washing their hands or in cleaning rituals at home. Blasphemy. At times patient can see a religious book and have blasphemous thought. Patient starts avoiding seeing religious books, going to the religious places, feels distressed that he is not that kind of person who should have this kind of thoughts, and at times it leads to depressive symptoms also. Need for symmetry, organizing the things in a proper manner. If they are not organized in that manner, the person will feel distressed, and he may spend a significant amount of time, at least more than 1 hour in a day, just organizing things. Compulsions are the ritualized behavior which are performed to reduce anxiety, such as if you have a thought of contamination, cleaning. If you have thought of if you have doubts, pathological doubts, whether you have done something or not, such as repetitively checking whether you have switched off the gas or not, whether you have locked your car or not, whether you have locked your door or not. So repetitive checking, and that checking can again be very time consuming. In addition to that, if these symptoms are present for more than 2 weeks, person should be evaluated for OCD. Secondary to OCD, depressive symptoms can be seen in around 67% of patients with OCD, and another 25% can have generalized anxiety related symptoms. What is the prognosis of OCD? Around 20 to 30% of the patients with OCD will have good response with treatment. Around 30 to 40% of the patients with OCD will have moderate response to the treatment. We need to understand that these conditions do come to the clinical attention after a long time, at times say difference of 5 to 10 years, because most of the time family is not able to understand whether this is a problem which needs to be treated. Medications there are good medications which shows response in OCD. In addition to the medication of pharmacotherapy, behavioral therapy such as exposure and response prevention is also useful, and at times if both are done in tandem, good results can be achieved. I hope through this video I have answered some of your questions regarding OCD. Thank you.